Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Lisa Centeno, who has over 15 years of both clinical and administrative healthcare experience with a specialty in addictions. She specializes in programmatic implementation, design, and execution to ensure that quality of care and patient satisfaction is upheld to the highest standard of care. Since January 2018, she has been the Senior Director of Substance Abuse Disorder Treatment and most recently became Administrative Director of Integration of Care at Bergen Newbridge Medical Center. People who have substance abuse disorder can experience stigma in healthcare settings because there's a misunderstanding that addiction is a choice. Too many times, the behaviors of someone in active addiction can impede the perception that their underlying health conditions are a result of substance abuse. As healthcare providers, we know that during comprehensive evaluations to fully understand the individual needs, example, history, frequency, use, medical and psychiatric comorbidities, motivation to change, and potential for relapse and recovery environment are all essential to gather before developing an individual treatment plan. Lisa, I'm really looking forward to talking to you about this important topic today. How are you?
Hi, Ro. I'm very good. I'm excited to be here.
So, how can we change the culture and perception within the healthcare field to ultimately help those in active addiction or recovery?
So I think that's a great question because I think, a lot of people want to help, but there is still, an underlying stigma that presents. So I think we just need to understand that people with addiction are people like everyone else, right? We have, whether it's any chronic disease that you have, whether it's asthma or diabetes, people need to get the care that they need to get. So we have to start to look at addiction and begin to normalize it because the likelihood of it happening to one of us or to someone we love is a pretty high chance. So we really need to start to, understand it better and become more informed so that we can welcome the patients, into whatever facility they're going to be coming to or coming to a wellness check, whatever the case may be. We want to make people feel comfortable and we want to really normalize addiction as much as possible.
Do you think people in active addiction go to the doctor for their annual wellness visits?
Not likely, Ro. When you're in active addiction, taking care of your health is usually not your first priority. So, you're doing a lot of things that are unhealthy, and that's because you're not in control. The prefrontal cortex with addiction is something that's greatly affected, and it's something that we have to be able to understand because that part of your brain is really responsible for people's, rationalization, being able to make good decisions. And when you become addicted, what occurs is that our limbic system, which is responsible for rewards, is the one that takes over and starts to tell, the prefrontal cortex, I'm in charge, and this is how we're going to proceed moving forward. So you're not really making the best decisions. And what happens is when you're not making good decisions, you're not taking care of your health the way that you should be.
So, what's the likelihood of someone in recovery to get their annual visits and assure that they're well?
I definitely think that goes up a lot more, the percentage of people going to healthcare providers once they're in recovery, because, if you look at it like this, they haven't been going to the doctor. So once they start to get coping skills in place and once they start to really focus on themselves and start to live a healthier lifestyle, of course, it's going to come up. Let me go see how my health is doing and really check in to see where I'm at. I do think that it is also a hard thing for someone to do that's been in addiction that has been addicted for quite a long time because there is a fear attached to that. How will I be perceived possibly when I go into the doctor's office? Do I tell them that I have a past history of substance use disorder? What is that going to do throughout the rest of the appointment? Are they going to be judging me? Also, is there any other diseases or any type of health issues that I'm going to find out when I do come for this appointment? And that can be something that somebody really fears. They haven't been taking care of themselves for a very long time. So now, what could be wrong with me? And those are things, though, as part of recovery, that we have to embrace, because we want to know if there's anything wrong, and hopefully we're healthy, but we want to be able to embrace those things so that we can, continue to live the life that now we're living, and we're, free from some of the issues that we had from before, and we're able to do the best that we can and live a healthy and productive life.
So how does somebody in recovery and or an active, addiction deal with those hesitations? You talked about real, obstacles in someone's way, especially if it's going to impede their health. How do they get around that? And how can we help them as healthcare providers to not have that hesitation?
So how we can get around, how they can get around it is they probably most likely at the point when someone's in recovery are going to have some sort of support system. So for anybody that is, watching and just has a loved one that is in recovery, really to be a source of encouragement and to let them know, hey, we're here for you. And no matter what happens when you go, we'll still be here at the end of that, and maybe even offer support to go with them, because sometimes it just takes knowing that someone is going to be with you in case there was something that you didn't want to hear. Feelings are fresh, in early recovery, and if something were to be said, or if a test result were to come back positive for something, that could really put stress on the person that is in early recovery. So really just having the active support system in place, and maybe even asking a loved one to come with you, and for the loved one to know if the patient, if the person's going to the doctor, hey, can I come along with you? And maybe afterwards we could go get some coffee, or we could, go shopping, whatever the case may be, but just to kind of make it a little lighter for that person that might be reentering, their physical health, and to really go in with a feeling of, okay, I'm supported, and no matter what happens, I have my support system here. As health providers, I think that we just have to really, watch our body language, as well as things that we say to somebody. Perception can be really, is everything. So if, you go in and someone says, I've had a past substance abuse of, using whatever drug that is, I think the person on the other side is really concerned. Will the doctor sit there and say, what will the comment be? Will there be a negative comment thrown out there that will then make the patient feel judged and say, I have to leave, I don't want to continue? People are already dealing with a lot of judgment in recovery. So, we have to really just watch how we communicate with patients and make them feel comfortable, because really addiction is like any other chronic disease. And we have to kind of put ourselves in place like that. With something like diabetes, we don't sit there if someone says something to us, they come back, their blood sugar is really high. No one says, I can't believe that you ate, 3 candy bars in the past week. What's wrong with you? So I think that we really have to be mindful in how we speak, because we don't know what someone's going through on the other side, and we definitely don't know their story when we're first meeting them. So if someone is, we're fortunate enough that someone actually shares their point of view with us and tells us about their history so that we can help them, we have to be solid, and we have to be able to, make that person feel comfortable, supported, and do anything we can to make sure that they continue to get their wellness visits, and they continue to, pursue a healthy way of living.
So just to go on, you talked a lot about, language, compassion, and I have to touch upon this. Do we live in a stigma-free world where when it comes to addiction, we talk about stigma-free, when it comes to mental health, but when it comes to addiction, is it different?
I don't think that we live in a stigma-free world. I think that that would be the ultimate goal, to live in a stigma-free world. We're not there yet. There's a lot of misinformation. I think the general public may think that addiction is a choice, right? Like this person, this individual continues to do this over and over again. Why can't they learn? Why can't they make a better decision? And just to go back to the whole, the addiction is a brain disease, we have to look at that and say, if somebody's prefrontal cortex is not functioning appropriately, then we have to understand that that person is not in charge of the decisions that they're making. And when the reward system kicks in and tries to take control of that, it's such a it's almost impossible to overcome, because you're releasing so many chemicals of dopamine, ultimate pleasure, for that person, that person doesn't know how to be at this point without the drug. So I think that the stigma really is, it's our job as healthcare providers, but also as people, to understand that it isn't a choice. We don't know who's going to become addicted to what, and we don't know what that looks like. And I think there's a lot of stuff that we still need to understand about addiction. We know that it's a brain disease, we know that it's a family disease, and we know that specific traumas can also trigger certain things in people in certain episodes. So I think we just have to be really careful. I think stigma will go away or really dissipate when we start to normalize that addiction is a problem just like anything else. Every single person probably in the world has some sort of addictive disorder, whether it's they're eating too much, they're shopping too much, they're gambling too much. And these are the types of things that I think that's when people can start to normalize it and really have some compassion, because there's not one person that doesn't have something that they do themselves that could be a little obsessive at some point. And, think of how you would want someone to speak to you if, you came to someone and disclosed with them, I'm having trouble, I'm spending too much money, maybe I'm losing my house, or I'm getting into fights with my loved ones. It's really all the same. Addictive disorders are, addictive disorders. We have to learn that it's normal, and how do we help people move on and go into recovery.
So to go on to the recovery piece, what is the rate of relapse of substance abuse disorders?
So anywhere from 40 to 60%, and about is the rate of relapse. The more time that you actually get away from using, so if you have at least 1 year of clean time, the likelihood of you sustaining that recovery continues to go up every single day that you're in recovery. But relapse is part of recovery, but it also doesn't have to define recovery. And I think that's important. I think a lot of people are like, oh, well, they're in recovery today and tomorrow they're not. What does that mean? And then that kind of makes everyone, doubtful, maybe feel like there's not so much hope with this, with people with SUD, that population. And I think that that's not fair, because every single one of us is human, and we all can go back into different behaviors that can be harmful to us. So I think that that's really, really key, is that yes, relapse can be part of recovery, but it doesn't define recovery, and it doesn't necessarily have to be that way. And relapse with drugs is also one part of it. Relapsing behaviors is another. So if you have relapsing behaviors, if you start to notice that you start to, maybe manipulate situations, or begin to start to tell more and more little white lies, even as harmless as that sounds, for someone that is in recovery, they're trying to live the most simplistic, honest life that they can. And that's very important to people that are in recovery. So it's important to understand that piece.
Understood. So when you talked a little bit about, recovery, and that it's part of the relapse is part of the recovery piece. Is that piece treatable?
Absolutely. I mean, that's why we're here, right? Healthcare providers across the country and right inside of our hospital. If we didn't think something was treatable, then, we're here. Everybody has hope. And just like any other chronic disease, it's treatable. It's treatable with counseling, any type of psychosocial support. medication-assisted treatment, which is specifically for substance use disorder populations. And so in conjunction with psychosocial support like counseling and also having medication-assisted treatment, we have some really good ways of helping to fight addiction and really helping a person to get back to a healthy life.
I'd be amiss because maybe people don't know the answer to this, but to be someone that has a substance abuse disorder, what does that mean? I mean, is it drinking every single day? Is it, using, twice a month? What does that mean?
So it's a great question, because a lot of times I remember also when I was in school and we had to we were in classes about diagnosis, and everyone would leave the classes saying, oh my God, I have this, I have this, I have that, and the thing is, there's criteria. So for substance use disorder, there has to be at least 2 or more criteria hit within a 12-month time period. And some of those examples could be tolerance, having to use more and more to get the desired effect, withdrawal symptomology from substances like alcohol, opiates, benzodiazepines. Problems with interpersonal relationships is a big issue. Cutting down on things that you used to enjoy and just not being present in your life. Legal involvement, hazardous behavior. So there's so many different things that go into it. And if everyone says, oh my God, what if I have this, do I have a substance use disorder? I drank too much on Friday, or different things that people, will bring up when I've been doing other trainings. There's criteria, and at least 2 of those 2 or more have to be hit within a 12-month period for it to be classified as a substance use disorder.
Oh, makes sense. So, so if someone's in recovery, you mentioned medication assisted treatment. Are they in recovery if they're using a medicated assisted treatment?
That's a great question. So yes, they are in recovery, and I think there is some confusion. Hopefully that is getting better than it was. Medication-assisted treatment can be anything from, methadone maintenance, Suboxone maintenance, also Vivitrol. They all act a little differently. Like methadone is a full agonist, which binds completely to, to the opiate receptors. And then you have Suboxone, that's a partial agonist. And then you have Vivitrol, that's an antagonist, and it completely blocks the mu receptor. So, and Vivitrol is actually not a mood altering substance, but no matter what medication assisted treatment that you are providing to a patient, it needs to be clear that that is a prescribed, medication. And just like any other thing, like insulin, it is prescribed. And if you utilize it the right way, it's for recovery. And, the abuse of substances should not even be a thought when, we're thinking about how to help someone that is, that's having issues with their addiction, because this can be they are life-saving methods for sure. And people will say, well, I don't understand. Methadone, is a full agonist, it's a drug, and so is Suboxone, and they can have mood altering effects. But if you're able to function in society and you're able to have a job and live your life to the fullest and have great interpersonal relationships and, really do all the things that you were missing out when you were in active addiction, there's really nothing you can say that would even amount to, you can't argue it. Medication-assisted treatment is amazing. It saves lives. And also on the other side of that, there's psychotropic medications. So for, a good 80% and upward of patients that have substance use disorder, we have co-occurring disorders. So whether it's depression or anxiety or, bipolar disorder, whatever the case may be, those medications are also extremely important as part of someone's recovery, because again, there's all different reasons why people have different addictions to different things. And, just really understanding that and treating the patient comprehensively from the beginning will really help the patient to achieve and sustain that recovery. And you would never look at someone taking, Lexapro or Prozac or whatever the case is for someone that has, mental health issue. You wouldn't look at that as anything, that they're trying to abuse the medication. It's the same thing with someone that has substance use disorder. These medications are meant to help somebody better their life and to live, a life of sobriety.
So, in addition to the medication assisted treatment, is there other components to it that can make the recovery more successful?
Absolutely. So, I mean, medication assisted treatment is one part. A lot of times people say, it's like, okay, well, just take the medication. If you just take the medication and you don't deal with the other issues that have happened to you in your life, trauma, and trauma can be anything. It can be a sense of loss, and that could be, when you're growing up and your parents got divorced. It could be abuse. It could be, you were in a horrible accident, or there was, you have health issues, things that occurred, and they can be very stressful to you. So trauma is real. And if we don't address those traumas in conjunction, by going to counseling and by going, sometimes it's a private therapist, and, by doing the whole comprehensive package, you're not going to get to a sustained recovery. You might be at recovery for a very small amount of time, but that's not going to be a long-term recovery. You have to address every part that could possibly, that have caused these things to occur, and really look at what's happened in your life so that you can make sense of it. And once we identify things, we can make sense of them. We can process them with, counselors and social workers, and be able to understand more about ourselves as well. Sometimes there's a lot of shame with people that are in recovery, and sometimes we need to understand like what things happened to us, when we were younger, or our family dynamics, and know that is not your fault. Like certain things that occurred, you had no control over. So you grow up with all these feelings that you don't know how to deal with. And what happens is that you turn to something, and with everyone it's different. So understanding yourself better, maybe even doing some family work with your family, and making sure that you're with a trained professional to do this, as well as, having the medication assisted treatment. It's a win-win all the way around.
It sounds like it is. Recovery is so important. So let's talk a little bit about recovery. Recovery is such a broad word, and some people think that once you're in recovery, you're cured. Talk to me a little bit more about recovery.
So recovery is going to be different for everybody, right? And I think that is what, I think that's actually what's stopping the world from moving forward with recovery, and just even how they perceive addiction. Recovery is going to look very different for different people. Sometimes people are going to, be on medication assisted treatment. Sometimes people, and medication assisted treatment is also not just the three that I mentioned before, the methadone, Suboxone, and Vivitrol. There's also other medication assisted treatment that people can also pursue. And, whether people feel one way about something or not, it comes down to, like, even with medicinal marijuana, that's also listed as a medication assisted treatment for patients with opioid use disorder, as well as it helps treat pain. So I think that just like the perception, again, of how one views what recovery is not what recovery necessarily is to that person. And we have to be able to meet the patient where they're at, and be able to say, okay, well, maybe this person at this point, coming off, a drug addiction of, being addicted to heroin for the past, 5 years, if that patient wants to take Suboxone, even though it's still considered, a drug, a mood altering substance to some extent, it's a lifesaver to that person. And that person using the medication correctly is not abusing the medication. So, this kind of goes back and forth. Vivitrol is an antagonist, and while Vivitrol is super, super effective, and it blocks, completely blocks all the opiate receptors, meaning you can't even, if someone were to try to take an opiate when they had Vivitrol injection, they would not be able to experience any of the effects. They would not get high from that. It's a blocker and it stays in your system for 30 days. So the fact that that happens, yes, will people still try to test the waters with Vivitrol? It can happen, but they still wouldn't feel the effect. It can be, they could still do harm to themselves, of course, but they would not get the reward of feeling the effect. I think that understanding that different people, especially in our field, different people think, okay, well, Vivitrol, that's the only thing that someone should be able to take because it's a blocker and it's not a mood altering substance. Well, that's not, a fair assessment to make because you don't know what's going to work for each person. And that's why, it's so important to have an individual treatment plan. Different people are going to do well with specific interventions and others aren't. And, it's all of us have gone to the doctor for different ailments throughout the years, and different things work for different people. Different inhalers work for me that didn't work for me in the past, and it's the same thing when somebody is going and trying to treat their substance use disorder. Sometimes somebody needs a blocker like a Vivitrol, and sometimes somebody needs, a partial agonist like a Suboxone. And who are we to decide what's appropriate for that person? That person knows what's appropriate for themselves. And if they, at that point, try something and it's not working, that's why they have to have the support in place so that they can, be able to talk and process what's going on and what they think is maybe not effective for them, and to really work it out with their healthcare provider to make sure that they're making the right decision and change course if necessary. It's okay to change your mind and to do things different, if that's what we need to do.
So how do people sustain recovery? What's the best way?
So again, I think it's like a very personal thing, and I think how they sustain it is very different. It can be different from how I would versus how someone else would. Some people go to 12-step meetings, and they're that's something that they do regularly. Sometimes they go 3 times a day. Sometimes they go once a day. Sometimes it really is up to the person. Sometimes people come to like an intensive outpatient program where that's like about 9 hours a week. Where they would come 3 days a week for 3 hours each time. And some people get individual counseling, at a private practice. Most important, what's really important, I think, in addition to really looking at getting care from, the providers, as well as being able to, also have the medication-assisted treatment, is to really look at your inner, your support system and your inner circle. Because, aside from having these other interventions that we've spoken about, you need to be able to be around people that understand you. And, recovery doesn't have to be the topic of conversation, every single conversation that you have. You're going to be able to live a normal and healthy, productive life. It doesn't have to take over your life. So with that being said, just really having a supportive, support in your life, and really talking to your family too, because families, we love our families, but families also can trigger us like no one. Just family dynamics and how it's been created throughout the years, and there can be a lot of damage done in families, but families can also learn how to put it back together. And we can learn to, have different relationships and speak to each other differently and really start to understand one another better. And it's not about blame. It's not about saying, well, you did this to me and that's why I'm in this predicament. It's about understanding, because we all experience life differently and we all go through things in different life stages. And I think that that's what's important to know too, because as you get older, you also start to look at your parents a little bit differently and, say, wow, I do understand what happened when I was younger, different things that occurred, you're able to make more sense of and have more compassion. And on the same, parents that have been through this with their loved one, their child, it's exceptionally hard because they're afraid and, they just want them to get better. And sometimes parents want things to happen right away, and things don't happen right away. We all wish that they did. But it's a process, and as long as the family is there to be part of that process, it's going to be beneficial. And sometimes in the beginning, there is no, sometimes in the beginning, there has to be a period where we're not speaking, where we kind of learn, about ourselves a little bit differently, and the family gets a little bit of a breather to really kind of look at their situation, look at their relationships, and how they, played, I don't want to say played a part, but addiction is a family disease. So what are the things in the family that are going on in that family, whether, maybe there were, specific issues with the parents, maybe there's a brother or sister that becomes, some kind of issue, behavioral issue, or what have you. So there's all different things that can occur within a family system. And it's important not to blame, but to say, wait, what could we do better as a family to build our family back together? And that includes the person that now is in recovery. And how do we start to, all live together and be able to share the things, maybe not the same things that we used to, maybe start a new dynamic and start other things and do other activities together that will replace some of the, maybe some of the bad patterns, problematic patterns in the past that weren't healthy to them or to the person that was suffering with their addiction.
This is all important information, and I think the biggest part here is exactly what you said at the end is, family dynamic. A person in recovery needs the support from his family and his loved ones in order to be successful. So I want to thank you for taking the time to talk to me today, Lisa. And, our audience, of course, thank you for being here. And I'd be amiss to not talk about, if you have a loved one or you yourself are struggling with a substance abuse and you'd like to talk to someone about the process, please call our Access Center. Is that correct, Lisa?
Yes, you can call the Access Center for our medical detox services or for our short-term residential. And then I believe there's also going to be another number that you can call for our outpatient addiction services that include our intensive outpatient program and our medication-assisted treatment. We do have outpatient services for adults and for adolescents as well.
Awesome. Thank you again. And if you would like to support our foundation, please visit us at newbridgehealth.org. And I wish you all a great weekend. Thanks again, Lisa.
Thanks, Ro.
Bye-bye.
Bye.